Extravasation refers to the accidental leakage or escape of a substance, usually a medication or fluid, from a blood vessel into the surrounding tissue instead of remaining within the intended intravascular space. This can occur during medical procedures such as intravenous, IV injections or infusions. When extravasation happens, the substance can cause damage to the surrounding tissues, leading to inflammation, pain, and potentially serious complications. Causes of extravasation: intravenous insertion issues, high-pressure injection, vein, fragility, chemical irritants. Intravenous insertion issues: improper insertion of the IV catheter or needle can damage the vein wall, leading to leakage of the injected fluid or medication. High pressure: rapid infusion of fluids or medications at high pressures can increase the risk of extravasation. Vein fragility: fragile veins, particularly in elderly or critically ill patients, are more prone to damage and subsequent extravasation. Chemical irritants: some medications, especially chemotherapy drugs and certain antibiotics, are known to be highly irritating to tissues if they leak outside the vein. Symptoms and signs: swelling, immediate or delayed swelling at the injection site, pain, localized pain or discomfort, redness. Skin around the injection site may become red or warm to the touch, blistering or tissue damage. In severe cases, the skin may blister or become necrotic, dead tissue. Management and treatment: immediate recognition, discontinuation, elevation, aspiration medication, immediate recognition. Prompt recognition of extravasation is crucial to minimize tissue damage. Discontinuation of infusion: stop the infusion immediately if extravasation is suspected. Elevation and cold compress: elevate the affected limb if applicable, and apply a cold compress to reduce swelling and inflammation. Aspiration: aspiration of extravasated fluid or medication using a syringe, if possible, to reduce the volume of the extravasate. Antidotes or specific treatments: some medications have specific antidotes that can be administered to minimize tissue damage, e.g., hyaluronidase for certain extravasations. Follow-up care: monitor the affected area closely for signs of tissue necrosis or infection. In severe cases, surgical intervention may be necessary to remove necrotic tissue. Prevention: proper technique. Ensure proper placement of IV catheters and secure them adequately to prevent movement. Patient education: educate patients about the signs and symptoms of extravasation and encourage them to report any discomfort or changes at the injection site promptly. Monitoring: regularly monitor the infusion site for signs of infiltration or extravasation during IV therapy. Overall, extravasation is a serious complication that requires prompt recognition and appropriate management to minimize tissue damage and potential long-term consequences for the patient.